So for this patient, actually probably the prescription was not submitted. So what might have gone wrong, I'll just explain over here. Go for view details. Actually, if you see the patient's WHO ISH card, CVD risk is more than 40%, BP is quite high, and how we should handle it, basically she should be given double combination at this point of time. So what will go ahead, I'll go in prescription, then I'll go in prescription again, and what you'll have to do is add RX, select category. So this is hypertension, select medicine. It should be amlodipine plus hydrochlorothiazide. That's the best way to start her with that, and then start some of the aspirin. So go in heart attack and then start with aspirin over here. That should be the 75 mg as of now. That comes into the afternoon, and 30 days. Best way, try it for 15 days and check the blood pressure again after 2 to 3 weeks, and then again we'll go ahead with the with her modification of titration of the doses. So basically what you'll have to do is you have to first click on the add prescription, so that this goes and gets added over here. So that is first. So I did it, add prescription. Now what is important, if you are finished with prescribing all the medications, you are not to prescribe anything else more over here, then what you will have to do is that you have to click on this submit button. So until unless you click on submit button, prescription will not be added finally to the patient. So I'll make a submission over here. So this way there is this window where you have to advise to the patient for exercise or salt reduction, or if any ECGs or anything else, if whatever you want to, and then leader also you'll have to advise whatever you want, and then follow up date you'll have to set over here, and then submit it out. When you submit this way, actually the prescription is generated. You have amlodipine plus hydrochlorothiazide. You can share this with the patient in PDF format, and we have a system to give them in a printed format. So this way the prescription get generated, and this prescription can be handed over to the patient as well immediately. So if you can see over here, you have amlodipine plus hydrochlorothiazide and aspirin over here, and then you finish of the appointment. So this way it should be gone. You can see the ECG of the patient over here. If we want to discuss the patient ECG of this particular patient, this seems to be LVH, left ventricular hypertrophy. So and the axis is also left axis deviation. So LAD plus LVH is there. It does mean that end organ damage is setting up for this patient. So we need to do her urine albumin as well. So probably on follow-up we can do that. So this is the way. Probably just find out where you've gone wrong to prescribe the patient, and this is the way. Thank you so much.